And now, we bring you the following live press announcement from D.C. Mayor Muriel Bowser. Our regularly scheduled program will resume following the announcement.
Good morning, I'm Muriel Bowser. Am I on? Can you hear me? Good morning, I'm Muriel Bowser, I'm Mayor of Washington, D.C. I'm joined by members of our Public Safety Committee, including Acting Chief Rob Conti of the Metropolitan Police Department. We're also joined by Deputy Chief Pamela Smith of the United States Park Police. With me as well, members of my cabinet, Dr. LaQuandra Nesbitt, who is the Director of DC Health, and Chris Rodriguez, who is the Director of DC Homeland Security. I want to wish everybody a Happy New Year and welcome. I hope everyone had a restful holiday. And today we are planning to talk to you about the district's response to COVID, as well as the district's preparations for First Amendment activity, demonstration activity in our nation's capital this week. Let me I'll start by showing our metrics related to COVID. We have been reporting those metrics throughout the holiday season. You have noticed over those days some ups and downs in those numbers. I'm pleased to see that today the daily case rate is lower than we've seen in several days. And you also notice our health system capacity category, public health system capacity category, as well as community engagement. We have been spending quite a bit of time talking to our residents on various platforms about the importance of answering the call for DC Health. When our contact tracers are reaching out to you, it's very important that you answer to the call and follow the instructions that they provide. We remain in a very critical time with this virus, so following all of DC Health's guidance and advice will continue to be important. We also are in the process of our vaccine distribution. We have spent, and we're very happy to say that our system is working to get the vaccine out to our prioritized communities. So I want you to continue to follow at coronavirus.dc.gov when it's your turn and be prepared to get the vaccine. Almost 17,000 people have been vaccinated with their first dose. The district has received just over 40,000 doses, and additional doses become available each week. We want to point out that we have started weekly reporting of this vaccine distribution. It's not fully activated as yet, as those numbers represent about 58% of our vaccinators reporting. So as we begin this process, just bear in mind that it's getting fully rolled out, and those numbers will change. Again, that's available at vaccinate.dc.gov. I also want to be real clear about our portal, and Dr. Nesbitt can say more. This is helping us with our first group of people who are eligible for the vaccine in the district. Those are people who work in healthcare settings in DC. If you work in a healthcare setting in DC, you can go to vaccinate.dc.gov to schedule an appointment for your vaccine. Those people include acute care hospital workers, workers in specialty care hospitals, long-term care facilities, intermediate care facilities, emergency medical services, frontline public health settings, home health aides, outpatient settings, dental settings, and pharmacy settings. So that's a lot of people who work in healthcare who can go to vaccinate.dc.gov to set up their appointment. DC Health, of course, is also very focused, and we get this question a lot, and I want you to pay close attention to the word target dates for vaccinations, because this is how we expect these groups to roll out, but this is subject to change, both earlier and later. So these are the targets that DC Health is setting up right now. The week of January 11th, we hope to open the vaccinate.dc.gov scheduling system to DC residents who are 65 and older. By the week of January 25th, we are aiming to open to specific categories of essential workers, including public safety workers, grocery store workers, workers in pre-K through 12 educational settings, and child care settings. In the week of February 1, we're aiming to open to DC residents with chronic medical conditions and other essential workers. So remember, these are target dates. We would be prepared to turn them on sooner or later, depending on what DC Health needs to get done. Let me also just say a few more things about the vaccination. There are currently 2 approved vaccines, but we are encouraging Washingtonians to take the first vaccine that becomes available to you. There are a couple of differences that DC Health will go over. Both vaccines require a second dosage, either 21 days later or 28 days later. Finally, we want to remind everybody to continue to follow good health guidelines to prevent yourself from being exposed to the virus, and also know, and you will be reminded of this at the time of vaccination, that it takes some time after your second dose for the vaccine to build up. And that's all I'll say about that, because Dr. Nesbitt will talk about that. Now let me move to public safety updates. And I want to be clear, we know in Washington that as our nation's capital, we have a lot of experience with people coming here to protest and directly grieve the federal government, and we expect that activity this week as well. And we are urging DC residents, people from around the region, to avoid the downtown area, and especially avoid people who are coming here to look for confrontations, particularly physical confrontations. So we're asking you to avoid the area that we will set up a traffic box around on January 5th and January 6th. Of course, people are allowed to come into our city to participate in First Amendment activities, and they will be mindful of the laws of the District of Columbia. We will not allow people to incite violence, intimidate our residents, or cause destruction in our city. So again, we're asking DC residents and people who live in the region to avoid confrontations with anybody who's looking for a fight. And the best way to do that is to avoid the area. Here I'm going to turn now to Director Rodriguez to talk a little bit about what we know about planned activity. Chief Conti will also talk about MPD's preparedness. Director Rodriguez.
Thank you, Mayor Bowser. Over the last week or so, we have been, as a district government under the mayor's direction, been coordinating with the federal government, with our federal partners who are here today, particularly the Park Police, and making sure that we're sharing information. We are mobilizing all of our efforts to ensure safe and secure First Amendment demonstrations. The Homeland Security and Emergency Management Agency has been working very closely with the Metropolitan Police Department and Chief Conti and his team. At the mayor's direction, the Emergency Operations Center was stood up this morning at 8 a.m. to begin monitoring the security environment in the district and sharing information and and filling any resource requests that our public safety agencies might need. About an hour ago, Chief Conti, myself, briefed the council on our preparations for the events coming up in the next few days. And today we will also have a community call with the Mayor's Office of Religious Affairs, religious leaders across the city, the Office of the Deputy Mayor for Planning and Economic Development, and also talking to the bids, particularly the ones downtown, that are going to be potentially impacted by the demonstrations that are occurring over the next couple days. Thank you, Mayor.
Thank you. Chief Conti.
Good morning, everyone. In addition to what Director Rodriguez has talked about, several points we want to make. First and foremost, we initiated the placing of signage throughout the downtown area, specifically the demonstration area, just notifying the public that firearms are not permitted. I repeat, firearms are not permitted. In the demonstration area, there are signs that are posted. Anyone in violation of the posted signs, anyone in violation of District of Columbia law will be arrested. So I want to be very clear about that, because we have received some information that there are individuals intent on bringing firearms into our city, and that's just will not be tolerated. In addition to what the mayor has already said, under the mayor's direction, we have reached out to the DC National Guard. And we have received confirmation that the DC National Guard will be assisting the Metropolitan Police Department beginning tomorrow through the event, throughout the life cycle of this event. They will be here. They will be deployed to assist us with crowd management as well as traffic control in our nation's capital. That will allow for the police officers to focus on anyone who's intent on instigating, agitating, or participating in violence in our city. Again, unacceptable, and we will not tolerate that. So the National Guard will be assisting us in our efforts as well.
Thank you. Thank you, Chief. And next, I just want to make everybody aware of the emergency no parking restrictions that will be in place in the perimeter around the demonstration areas. So please check before you travel, so you will know how to detour around this area to get to all of the things and you will want to do over those several days. You may also register for important alerts from the district by signing up for alertdc.dc.gov. So with that, we will take your questions. Any questions? Yes, ma'am.
On the vaccine website, it says about 36% of vaccine appointments are booked from those healthcare providers reporting. I wonder what you're hearing from these healthcare settings about people booking appointments. Is vaccine hesitancy a concern? Are workers just busy responding to COVID? Can you just provide more insight into that?
So I missed the very first sentence you said.
Sure. I'm seeing it's like 36% of vaccine appointments are booked, right?
I got it. So
Yeah.
your question is that there are many opportunities for
That's right.
people to make appointments. Okay, Dr. Nesbitt?
Sure. So thank you for the question, and it's a great opportunity for us to highlight and differentiate the different settings and environments and opportunities for our phase 1 population to be vaccinated in the District of Columbia. You'll recall that when we launched the program, the COVID-19 vaccination program in the District of Columbia the week of December 14th, we began with our acute care settings, which was within our health system. So all of our large health systems and hospitals in the District of Columbia began vaccinating their workforce. And we also had a partnership with Kaiser to begin to vaccinate some public health frontline workers and our emergency medical services providers. So that's a population or an infrastructure infrastructure that has been vaccinating people who work in hospitals, inpatient psychiatric environments, and their network. So they do not schedule for those appointments through vaccinate.dc.gov. There's a second partnership, what we call the long-term care partnership, that was activated the following week once we received notification from Virginia and Maryland that we would be receiving additional doses of vaccine, that will partner with both CVS and Walgreens to allow for vaccination of residents in long-term care facilities as well as staff of long-term care facilities to be vaccinated. They do not have to schedule through vaccinate.dc.gov as well. So they can schedule, they can be vaccinated, those long-term care workers can be vaccinated on site in the facility that they work in when those clinics began. Those clinics have not really began in earnest. They haven't ramped up. That will begin this week. To date, 1 or 2 have began, and about 100 residents and staff of long-term care facilities have been vaccinated through that long-term care partnership. Vaccinate.dc.gov, where about 36% of appointments. So there's lots of opportunity for healthcare workers in phase 1A. So all of those folks that we're talking about, people who work in acute care hospitals, specialty care hospitals, long-term care facilities, we really want them to be vaccinated through their hospital. So if you work at GW, Howard University Hospital, United Medical Center, Bridgepoint, you can be vaccinated in those environments. If you're in private practice, if you're a dentist, if you're a pharmacist, if you're a speech and language pathologist who works in an outpatient environment, if you're a physical therapist who works in an outpatient environment, we're really, in home health aides, we're really targeting for you to go to these pharmacists, to these federally qualified health centers whose appointments are scheduled in vaccinate.dc.gov. So to fully appreciate and understand why 64% of those appointments are not scheduled, we think that it may be a function of people really not knowing that these opportunities are out there. I sent a letter last week to all of the licensed health professionals in the District of Columbia, tens of thousands of people who have been asking and wanting to know how to be vaccinated. We were working with a lot of their trade associations, organizations that they're members of. They had made lots of inquiry to us, and we were pushing information out. But we made sure that any address that they had on file with us that they used to get their medical license, we pushed out that information to them very aggressively last week. We'll do it again, so they make sure that they know about vaccinate.dc.gov. We'd appreciate your assistance in pushing out this information to them so they know that those appointments are available, because we really want them to fill up those 64% of appointments that are available. So that's really the target audience for them. It's really too soon to say that vaccine hesitancy in that population is the reason why they're not getting vaccinated. We think that maybe last week they did what a lot of people did. They took some time off from checking email. They took some time off from working and weren't paying attention to the flow of information. So we could really use a full court press to get people aware of vaccinate.dc.gov as a way for healthcare workers in the District of Columbia to schedule appointments and fill up all those slots.
Mark?
Staying with the vaccines, if we could,
Sure.
I'm wondering, one, do the vaccines expire? Is there any danger that since people aren't taking them and you have some around that they might expire, go unused? Is that a concern at all?
Sure, it's an excellent question, Mark. So all vaccines expire, whether we're talking about COVID-19 or the varicella vaccine or influenza vaccines, all vaccines and all medications expire. What is particularly of note with the COVID-19 vaccines is that the 2 vaccines that have been approved to date are what we call mRNA vaccines, and they have very specific storage requirements. And so you have to keep them stored at very specific temperatures. So the Pfizer-BioNTech vaccine has one set of storage and handling requirements, and the Moderna vaccine has another. So you have a certain number of days that the vaccine, once it is removed from its very cold, like frozen temperatures, that once you thaw it, it has to be used within a certain period of time. And once it is completely, if you move it from the sub-zero Arctic temperatures to refrigerator, you have a certain period of time that you can use it. And once it's thawed, you have a certain number of hours by which you can use it. So that's really what we're talking about when you hear wastage of vaccine. We have given all of our providers very clear instructions that once a vial of vaccine has been removed from the refrigerator and it has been thawed and you have a number of hours to use it, is that any person who is available to be vaccinated should be vaccinated. So even though we're in phase 1A, if you have a healthcare facility where you have other essential workers who are around and can be vaccinated that day, you should vaccinate those essential workers in lieu of wasting vaccine. If you are a healthcare facility that has patients around who could be vaccinated that day, you should vaccinate those patients in lieu of wasting vaccine. So our goal is to have minimal wastage of vaccine, and if there are people who are available at the end of the day to be vaccinated, then you should vaccinate them. Many of our hospitals and health systems have on-call list of employees who will come in to be vaccinated in order to prevent wastage.
Has there been any wastage that you're aware of so far?
So I will be reviewing that data. We require all of our providers to report wastage data to us. But as the mayor reported, we have about 60% of providers who are actively using our immunization information system appropriately. But we are required to have wastage reported to us, and we are required to report wastage to the federal government.
And so has any been reported?
I have not noticed a significant documentation of wastage, but that is a data element that is required to be reported to us.
And then another question about the way the system is working. It appears to be completely on the honor system. People anecdotally that I have talked to who have received the vaccine have not been required to present anything other than the barcode when they arrive, not ID, not proof of insurance, not proof that they are in 1A, despite that it says that they should bring that with them. And I'm just wondering, why that is. We've seen in other jurisdictions where there actually have been problems with people sharing the barcodes, and I'm wondering if that's just a product of we're early in the system and you'll get there, or why so far people are not being asked for any documentation.
Sure. So we leave it to the discretion of the vaccinating provider in terms of validating identification. They also have the responsibility of billing for the procedures. So how they choose to validate an individual's identity is at their discretion as the billing provider. But in order to register for the appointment, an individual is asked to provide information. And they do have a point where they do document that everything that they have entered is correct. So they are asked to enter information that declares that they are in fact appropriate for whatever level we are at that time. Right now we're in phase 1 with healthcare workers, so they provide information in the system that confirms that they meet that priority group's criteria. And that is what releases to them a barcode. If they give that barcode to someone else to be vaccinated in lieu of themselves, they are in fact, could be at some point, because insurance information is being accepted or requested or used to process that claim, there's a whole other set of issues that could ensue for them.
Sam?
Dr. Nesbitt, I'm kind of confused about Walgreens, CVS, and vaccinate.com. Is it all the same thing, or can you explain the difference there?
Wonderful, Sam. Fantastic question. There's a lot of different jurisdictions have used different approaches. To date, the District of Columbia has relied heavily on our existing healthcare infrastructure and existing healthcare resources to vaccinate our population. The federal government entered into a partnership, what they refer to as a long-term care partnership, to vaccinate residents and workers in long-term care settings, which includes skilled nursing facilities and assisted living residences. That partnership in our region includes CVS and Walgreens pharmacies. So pharmacists and appropriate healthcare personnel, which could include pharmacy technicians and pharmacy interns, pursuant to their regulatory authority and scope of practice, can vaccinate individuals in long-term care facilities. If a jurisdiction activates that partnership, which the District of Columbia did do, and long-term care facilities opt to participate in that long-term care partnership within their jurisdiction, which all of our long-term care facilities did. So the staff at these CVS and Walgreens will actually physically go to those sites. So the residents and the staff do not have to actually go to a CVS and Walgreens pharmacy. So they take all of the materials, the vaccine goes to the facility, and they're vaccinated on site. So it creates a tremendous convenience for the staff, and it allows all of the residents, many of them who have mobility issues and challenges, to be vaccinated in effectively what is their home. We then,
They don't have to do an appointment.
they don't have to schedule an appointment. Those clinics are scheduled, and their follow-up second dose vaccines will be scheduled as well. The vaccinate.dc.gov system is something that we created in the district as a means of creating community access points, beginning with our phase 1A group. And we partnered with many of our community health centers and our pharmacies that are not engaged in the federal partnership, which at this point includes our Safeway and Giant pharmacies, can expand to include other retail pharmacy locations, including independent pharmacies. And our community health centers gives us coverage across all 8 wards. So when someone, right now it's including our healthcare workers, goes to this website, they're able to look for an appointment time that is convenient for them, as well as a location that is convenient for them to be vaccinated. So we're not creating a competition between CVS and Walgreens that's obligated already in terms of resources and time to our long-term care facilities, and we're using the capacity of pharmacists who are trained and have this credential to be able to vaccinate, as well as our community health centers, which give us great geographic coverage and access points across the city to be able to provide COVID-19 vaccination.
But a member of the public that just wants to get vaccinated that falls into one of these categories should call should go to vaccinate.dc.gov, not to CVS or Walgreens.
Yes.
That's
If they
correct.
are a
If they go to
healthcare
vaccinate.dc.gov, do not call the pharmacy directly. Go through the website. And as we move through the different phases, the website will still be your portal of entry.
Yes.
Dr. Nesbitt, do you have any message to the community or any response to people seeing a report that a DC man who is not within the 1A phase category was able to get a Moderna vaccine just because they happened to be standing in line and the person administering it didn't want it to go to waste?
I don't.
I think you already heard, Stephanie, the guidance to DC Health about what the vaccinators are instructed to do. If someone didn't show up for an appointment, for example, and that vaccine needs to be used.
But is there a concern now that people might be hanging around hoping that that might be the case for them as well?
I mean, I don't know that we've seen any evidence of that,
Okay.
but I think that you can see from the discussion that when we're scheduling appointments, there will sometimes be, for a lot of reasons, people who miss an appointment. And if the instruction from the health department is to the vaccinators to use that appropriately, then I think that's where we are with how we have to schedule right now.
Just 2 more on the vaccine conversation. Jurisdictions in our area have been reported concerns about people sharing personal links to sign up for the vaccine. Are you seeing that in the district, that issue? And then also, we are a few weeks from the start of the Christmas holiday travel. Have you guys seen any patterns that you can describe for us today?
Sure. To your first question, of course, every jurisdiction is going to see people sharing links, right? People share links to everything. When I was younger, and I wanted to go to some event and there was a discount code, people shared that discount code. So I wouldn't anticipate that people aren't going to share information about this is how you sign up to get vaccinated to see if people can break the code or break the system. What we're asking people to do is for our systems to work efficiently and to work effectively is to allow for the systems that we have developed to be only used for those that were asking to access the system at the time. If people rush to use this portal who are not healthcare workers, it will create a difficult time for our healthcare workers who are our phase 1A population from being able to use the system as it is designed. Similarly, when we move to another part of the phase 1 next week, as we hope to, for individuals who are over age 65, if people who are 27 years old try to use the system, it can create a challenge for that population as well. So our systems are designed to be used by the individuals we are asking to use them at that particular time. And as we have done throughout the management of this pandemic, we have asked for our DC residents to do what they always do, to be in this with us together, to be collaborative as a community, and to allow for us to design a system that puts those who are at greatest risk for illness and disease and death to be served first in our community. So while you can get access to the system and you can get access to any referral codes that we may create, it may disadvantage someone else who may have a harder time with COVID-19.
Yes, I'll come back on this side after everybody has a chance. Yes.
All right.
Julie.
I have two more vaccine questions. This is all very helpful. That 58% that's currently reporting in the vaccine system, how much they're distributing the vaccine, do you have plans to connect with more of the distributors and increase that number?
Oh, absolutely, Julie. This is another excellent question. This is a fun day. Part of what is transpiring here is we have what's called the District of Columbia Immunization Information System that we were planning to transition. And this immunization information system was largely used by people who provided vaccination services to children or individuals under 18. And we have always aspired to, at DC Health, really have this system become far more robust and have more information about adult immunizations, including adults who receive the annual influenza vaccine, information around hepatitis B and hepatitis A vaccines. So a much more rich repository of vaccination information. While COVID-19 has presented a number of challenges for our community, this has created an opportunity for us to expand how our immunization information systems have been utilized. So as we were upgrading our immunization information system, it has allowed us to connect more pharmacies to our network. Now, pharmacies in the District of Columbia have historically vaccinated adults. They have not historically vaccinated children. Now, what that means is that many of them were not already connected to our immunization information system. So they're sort of getting their sea legs in terms of how to use the system, how to report information, what all of the fields are that need to be reported, the importance of reporting 100% of the information 100% of the time. So we're really coaching them through the process. So we anticipate that the first few weeks and maybe the first couple of months will be a tremendous opportunity for technical assistance and guidance. So that's what we're doing with a lot of the providers who may be vaccinating a newer population for the first time, two, maybe using the immunization information system more aggressively and judiciously for the first time, or three, maybe new vaccine providers overall for the first time.
Thank you. And this group that's listed here as a target date for February 1st, DC residents with chronic medical conditions and other essential workers. Can you tell us more about what sort of chronic conditions are you talking about? What sort of essential workers are included in that February group?
Sure. I spent 2 Saturdays in a row with the listening in and attending the CDC's Advisory Committee on Immunization Practices meetings. The deliberations the weekend of December 19th and December 20th, spent a lot of time helping to delineate what the essential workers population included, and also spent some time speaking more directly about the risk of COVID-19, morbidity and mortality, and long-term consequences of COVID-19 for individuals with chronic medical conditions. So what we have been able to do is understand in a more comprehensive way the difference between frontline essential workers and other essential workers. So you'll notice that the week of January 25th, we started to prioritize those we consider to be frontline essential workers who in certain jurisdictions where seroprevalence studies were conducted had much higher rates of antibodies present than other essential workers. So we've been able to do that delineation. In terms of chronic medical conditions, we anticipate that there may be even more data available, but there is some evidence now in terms of which chronic health conditions have have a higher risk of hospitalization and death than others. So we may mirror that list, or depending on what the rate of uptake in our vaccine allocation may be, we may just allow for a broader more flexibility in terms of chronic medical conditions, but we'll make that decision as we get closer to the February 1st date, Julie.
So we don't know right now
Correct.
what sort of essential workers
Correct.
are included on
We
that
do
list.
know in terms of essential workers, it's listed there, January 25th versus February 1st. But in terms of having to further differentiate for chronic medical conditions, we'll make a decision as we get closer to that February 1st date.
Okay, I'm sorry, I see the list for January 25th. Where would I find the February 1st?
It's
list?
all the others,
All the
essential
others.
workers.
Got
Yes.
it, thank you.
Tom?
Thank you, Mayor. Both you and Dr. Nesbitt have addressed those people who are reluctant to take any of the vaccines. In this early stage, what kind of experience have you had with severe reactions to the vaccines in Washington, if any?
Sure. So we have not had any information reported to us by healthcare providers. I am meeting with scheduling a meeting tomorrow morning with hospital leaderships and their clinical leads to be able to get anything that they are seeing in terms of trends, but nothing has been reported to us that would rise to the level of concern at this point. That would not be anticipated or expected. Now, what do I mean by that? As you all know, I was vaccinated. That beginning that evening, I had some soreness at the injection site that lasted for about 1 to 2 days. I did enroll in VSafe, which is the CDC's monitoring program. They checked in on me daily for the first week, and now they check in on me weekly. Saturday, I received my email that reminded me that if I had not already done so, I should be scheduling my appointment for my second dose, which is scheduled for this Wednesday. So, and it asked me a series of questions in terms of if I'm experiencing anything, including the injection site soreness, if I have any other symptoms, if I've had to seek medical attention for my symptoms, and whether or not I have been diagnosed with COVID-19. So there are lots of things that are in place that help to pick up these types of things, and it asks you to take action if I were to answer affirmatively to any of those questions, and reminds me that I may be contacted by the CDC at any point in time depending on my responses. And all of us who get vaccinated get that sheet to sign up via, and you could scan a QR code, or you could just visit the website directly.
Okay. Mark?
3 quick questions to follow up on the COVID. One, when we get into these other groups, will you still be vaccinating non-DC residents when you get to people over 65, essential workers, people like that? Are you still doing DC and Virginia and Maryland residents?
Excellent question. We will only continue with the non-DC residents for workers. When we are in the populations who are 65 years and older, chronic medical conditions, we will need to be more restrictive to DC residents because of the way the allocations will be structured. But for workers, in worker categories, the essential workers, public safety workers, grocery store workers, pre-K through 12 educational settings and childcare settings, we will be open to those who are to Maryland and DC residents. I should caveat that with, we get a lot of requests from businesses and organizations to vaccinate their employees. All of those employees are not essential employees, so it would be very difficult for the district to vaccinate those entire workforces because they are not essential. That would be more things that we could potentially entertain in phases 2 and phase 3 when there is more vaccine available nationally for the district to access. But at this point, we really need to be focused on how we're managing the essential worker workforce. And our reason for doing that is, again, we're sticking to this criteria that assesses risk, and it's based on the risk of acquiring infection, the risk of morbidity and mortality, the risk of spreading infection, and societal impact. And we really believe that sticking to workers who are district residents only will not have the right kind of outcome for us from a societal impact perspective. If you think about our congregate settings and you think about our healthcare facilities, if we only vaccinated the workers in those environments who are DC residents, it would not have the right kind of positive impact on the DC residents who receive care and services in those environments.
And so to follow up on that, so teachers would be included, Maryland and Virginia residents who are teachers would be included. And I'm just wondering, as to teachers, I think you have them listed as January 25th. Does that give you enough time to vaccinate teachers before they're due to show up in the classroom on, some of them at least, on February, I believe, 2nd?
So it's a wonderful.
Yeah, but the two aren't linked.
Thank you. That's my answer. That's exactly the answer that I was going for. So it's
regardless of where, let me just say this, regardless of where we are, that's not linked to any phase of school reopening.
Yes. And it's critically important for people to remember as we're doing this, and we had a conversation at DC Health this morning that we're giving you data right now about the number of doses and the number of doses administered, but in public health, we talk about vaccine coverage. And I know many of you have heard us talk about the percent of the population that needs to be vaccinated in order for us to achieve herd immunity, et cetera. That's vaccine coverage. So, none of these things that we're talking about has really given you insight into vaccine coverage. So it's critically important that everybody be reminded that we can open schools with the social distancing and other mitigation factors that we have in place now. And we've got tons of guidelines for tons of sectors that can operate with social distancing measures in place. So that's the type of thing that people need to be reminded about. Vaccination and the road that we are on and this trip that we are taking with vaccination gets us to a place where we have coverage that eventually helps us to achieve herd immunity in this pandemic. But we're not at a place where we need to be thinking in these very sort of linear ways that one activity cannot be restarted or something cannot be reopened until we have vaccination coverage rates in a certain population or a certain segment of the population. I would think it very dangerous for us to start thinking that way.
Before you give 1 second, can you go back to the dates? And I just want DC. So when should the various categories expect to go to vaccinate.dc.gov to start their appointments?
So the date listed is when the vaccinate.dc.gov portal would be open and accessible
open to them. So yes. For those who are 65 and older who want to sign up, we're asking you to go on when we announce that it's open, and it looks like it is going to be one date next week.
And then my last question is about tent enforcement, and I'm just wondering what you
I'm sorry? Enforcement?
The outdoor dining enforcement, I'm sorry. Mm-hmm. Anecdotally, at least, I'm driving around this weekend and even coming here this morning, I see restaurants that are serving what appears to be in tents and patios that have more than 2 flaps that seem to be in violation of the mayor's restrictions on indoor dining. And I'm just wondering what kind of enforcement you've seen, if you've seen this, or what anybody can tell us about enforcement around the outdoor dining.
I don't know that we have that available this morning, but we can get back to you on that. Okay, is anybody not asked a question who wants to ask? Okay, I'm gonna take another swoop around this way, and then also if you have public safety questions, now is the time. Yes.
Thank you, Mayor. An ANC person just texted me and wanted to know, are homeless people being vaccinated, the people in the city, the homeless population? Can you give me any insight on that?
Yes, so I can address 3 settings with that one question that I think may be of interest. So we have opted to work specifically with the Department of Human Services, Department of Corrections, and Department of Youth and Rehabilitation Services outside of the vaccinate.dc.gov system and not require individuals experiencing homelessness and individuals who live in congregate settings that are not long-term care facilities to schedule appointments. But working with those 3 agencies to set up separate vaccination clinics and opportunities for those populations.
Yes, it says it's voluntary.
Yes.
Okay.
Yes.
So a person who is homeless can make the choice to take the vaccine. A person who is at DC jail can
Yes.
make a choice. It's voluntary. And just so you know, that's what it says. Yes.
I'm going to take my mask off. This is for Chief Conte. Welcome to the news conferences, Chief.
Thank you.
According to your briefing with the D.C. Council this morning, you're expecting a larger Trump crowd than previous demonstrations. The district has not issued any permits, only the National Park Service has issued permits. And you told the council you expect that Black Lives Matter placards will be targeted again, and you're going to station police at downtown churches and other vulnerable areas. Have you gotten any indication at all that the President of the United States, who's encouraging all of this, is going to be on the streets of Washington Wednesday?
Thank you for the
correct me, Chief, if I've misstated your briefing.
Yeah, so a couple of things. So with respect to the churches, we will be increasing our visibility around the churches in the area. Obviously, these situations are very fluid when on game day when things are happening, but we have checked out the area, the footprint where the demonstrations are expected, so we will be increasing our presence down there in the area. With respect to Black Lives Matter Plaza, operationally, certainly that is a consideration for us because it is a flashpoint for contentious interactions between demonstrators. And we certainly want to be, as we were last time and the time before that, we certainly want to be focused on that area operationally to ensure that we do not have violent incidents occurring at that location.
My understanding is you told the council that you would close the Black Lives Matter plaza, both to protect people who are trying to be there, who would like to be there, and also to keep all the signs from being torn down. Is that correct? Black Lives Plaza will be blocked off?
It is a very real possibility that we will have operationally. We may need to close that off. Again, it could be very much a game day assessment. Right now, with some of the intelligence that we're looking at, we want to make sure that we're in a posture certainly prepared to do that if need be.
You were criticized for not responding more quickly to the Proud Boys activity. I presume you'll be quick to respond, as you've said previously. But again, do you expect the president to be on the streets of Washington?
We're not sure whether or not the president will be on the streets of Washington. And with respect to any particular group, it really doesn't matter to me which group or which individuals. What we are particularly focused on is individuals that are engaged in violent behavior, whoever they might be. That's our focus. We want to be very intentional about that. Again, I think it's important to echo the mayor's comments with respect to DC residents. Please stay home. I mean, obviously, Dr. Nesbitt just finished talking about the pandemic and all the things that we're seeing there. There are going to be a lot of people here. We certainly anticipate that. And when we have a lot of people that are in our city, the chances for people to get sick, namely my officers and other residents, we just want to be very careful with that. Again, not sure if the president will be on the street or not, but we're certainly prepared if he will be.
I apologize. We were supposed to introduce ourselves for the benefit of the park police. Tom Sherwood from WAMU's Politics Hour with Kojo Nnamdi. Thank you.
Thank you, Tom.
Yes.
I'm Rebecca with WDVM, and this can kind of go to any of you, really. At the end of last month, Black Lives Matter DC released a series of demands, and one of them was the enforcement of mask wearing. I know social distancing might be kind of impossible in a protest setting, but is there any sort of movement that maybe DC government has made on making sure that, especially the out-of-town protesters, are wearing their masks and staying COVID compliant?
No. We, of course, we have seen the benefit in our city of mask wearing. Dr. Nesbitt reported a few weeks ago how well DC residents are doing with over, I think, 70% compliance. Not always perfect, but compliant. We know that we continue to have room to grow there, especially with people wearing masks indoors around non-household members. So we want to continue to have them do that. We do expect some flouting of our guidelines by out-of-towners looking for a confrontation. We're going to continue to remind them to wear their mask. We're going to continue to remind business owners to protect their businesses and their establishments with their own mask guidelines as well. I don't expect that I won't speak for Chief Conte that there will be a roundup of people arrested for mask violations. The police, as they've always have done throughout this pandemic, can use directives, they can use their speakers, they can use a lot of different tools to encourage people to follow the public health guidelines.
And do you have any concern about maybe Dr. Nesbitt, an increase in COVID cases after this protest, or have you seen any evidence of increase in cases after the previous ones?
Well, as the mayor mentioned at the beginning of her comments, because we are the nation's capital, we've had a number of people come here throughout the pandemic. And we have heretofore not been able to have any correlation between a surge or increase in our cases here in Washington, D.C. Immediately following any of the protests. And I think one of the other reporters here, Stephanie, posed a question which now creates an opportunity for me to, I think, more directly respond to it. Usually after a major or sentinel event, we see about 3 weeks after that any rise or increase in cases. And so the historical travel that just happened again this weekend after holidays, we have not yet seen an increase from that. So it would be very challenging for us to be able to unmask the pun here, huh? Any cause and increase in cases, but we are in our contact tracing going to be very focused on trying to ask any questions related to people's travel or intentional travel or activities in the district around inaugural activities or any of these things related to travel to DC intentionally for January. So we've been focused on trying to do that or capture that uniquely for quite some time.
Okay, Julie?
A couple of public safety questions. I'm Julie Zosmer from the Washington Post. First of all, can you give us just a rundown of what you expect for Tuesday and Wednesday? You know, rough size of crowds, where you think they'll be. I think Tuesday is sort of a more recently planned part of the demonstration, so we don't have a great sense, and I'd be interested in what you know about where people will be.
If we can start, Chief and Director Rodriguez, with talking about the permits that have been approved. I understand that Park Service may also be considering new permit requests, so we won't have that information available.
Yeah, so first of all, thank you for your question. The District of Columbia, we have not approved any permits for the District of Columbia. We are aware, and we have our partners here from U.S. Park Police, but some permits have been approved for U.S. by the United States Park Service, as well as we expect to see people that will gather in the area of the United States Capitol. So right now, it appears the United States Capitol, Freedom Plaza, as well as an event on the Ellipse. We expect those to be primarily the gathering places for some of the demonstrations.
And that's all on Wednesday?
split between Tuesday and Wednesday. And as the mayor mentioned, there are some new permits, applications that have come in, and again, just very fluid. We're not certain about where those events are, or where they're requesting those events to take place. Again, those were not submitted to the District of Columbia, so we will have to confer with our partners. In terms of crowd size, again, we don't know what the crowd size will be. We certainly anticipate, as we've seen over the course of the last two demonstrations, that there have been increased crowd sizes. Some of our intelligence certainly suggests that it will be an increased crowd, and we are obviously preparing for that.
And Mayor Bowser, are you considering a curfew as you imposed during the summer during some earlier protests?
It's certainly a tool that we will evaluate during the week. Mark?
Yes. If I could ask about somewhat public safety, but not related to this weekend, but the Congresswoman from Colorado, are you familiar with her tweets about she has, if you believe her video that she has posted, she has brought a Glock 9 into the district, onto Capitol Hill. I know she's allowed to have it on the Capitol campus, but she videotaped herself walking the streets of Washington, D.C., apparently with this gun concealed. And I'm just wondering what your message to her is. Is she breaking the law? Do you plan to investigate this? What can you tell us about this?
Yeah, I only recently heard about that within the last 30 minutes or so. What I will say to that is there are no exceptions in the District of Columbia. As you mentioned, well, with the exception of being able to carry in on U.S. Capitol Police property. For the District of Columbia, we plan to reach out to the Congresswoman's office to make sure that she is aware of what the laws of the District of Columbia are, what the restrictions are, and that Congresswoman, whoever it is, I guess it was from Colorado, will be subjected to the same penalties for anyone else that's caught on the District of Columbia street carrying a firearm, unlawfully, I might add.
Mayor Bowser, have you seen her video where she characterizes the district as one of the most dangerous cities in the country?
I haven't.
Do you have any message for her?
I'll just add to what the chief says. This is serious business. We should all take very seriously an American's ability to exercise his or her First Amendment rights, and we do. But we also have to know that we have a serious threat to our democracy right now, that the will of American people through a fair and just election is being questioned and violence is being incited. And that leaves the men and women who have sworn an oath to protect public safety in a very difficult position. The men and women of the Metropolitan Police Department, United States Park Police, United States Capitol Police, the Secret Service are all going to be out to protect the First Amendment, but also to protect people and property. Okay, so it strikes me as, it angers me actually, that any elected official would incite violence, put our city at risk, to put these men and women in law enforcement at risk, our residents at risk, and our beautiful city at risk. And I call on them to stand down on that activity, regardless of their political views. Our Constitution will endure. Joe Biden and Kamala Harris will be the president and the vice president of the United States on January the 20th. Yes.
Sam Forward, Channel 7. Chief Conte, are you, I was listening to Tom's question, are you hearing that President Trump is talking about walking around with the protesters this week?
No, I have not heard.
I didn't say walking around, I just said on the streets.
On the streets, but
In his car.
oh, in his car, okay.
Like he was at Walter Reed.
Oh, okay, I get that. Okay, that was a question of mine. And then for Deputy Chief Smith, just curious, what role will the Park Police be playing? What areas will you be focusing on?
Thank you so much. Well, we typically we certainly welcome protesters and will not tolerate any sense of violence, but we will certainly be in the particular areas that we've always been. We will be at the Ellipse. We will also be at Freedom Plaza. And I would yield to not discuss any of the other areas that we've talked about. We certainly partner with Metropolitan Police Department and work very closely with them in some of our geographical areas.
I see, and so you will also be in Freedom Plaza, assuming it's open. Chief, under what conditions, Chief Conte, under what conditions would you close Freedom Plaza? You said it might happen.
No, Freedom Plaza is open to.
No, I'm sorry, not Freedom Plaza, Black Lives Matter Plaza.
We want to make sure that we are not in position where we have groups that have assembled for the purpose of engaging in violent acts, wherever that might be, whatever street that might be on, whatever alley it might be in. We know that historically, over the last few demonstrations, that BLM Plaza has been a focal point, and we want to make sure that is not an issue this go round.
So there would have to be some incident there, or you just might decide you don't want to risk it?
It's part of our operational plan, and we'll assess it as we move forward, Sam.
Yes, Stephanie.
3 questions on public safety. I'm sorry, Stephanie Ramirez at Fox 5. Chief Conte, you had said that you were aware of individuals intent on bringing firearms to the city. We've been seeing reports of Proud members going incognito, dressing as Antifa members, also a possible armed encampment. Can you be a little bit more specific with the members of the public about what law enforcement is been seeing and what you're most concerned about? That's question number 1.
Yeah, I mean, I think it's pretty clear that it's already been out in the public sphere and social media that there are people intent on coming to our city armed and carrying firearms in the District of Columbia. In response to that, obviously, the Metropolitan Police Department has a plan, and that plan, part of that plan is to ensure that when these individuals are identified, that we're able to quickly and safely take those individuals into custody. I'm calling on the public, people who will be peacefully assembling. If you see anyone carrying a firearm or concealing a firearm, to please reach out to the Metropolitan Police Department. You can call 911, you can call 727-9099, you can send an anonymous text tip to us at 50411. But we appreciate the information because I'm certain that those people who are peacefully gathering do not want to be surrounded by individuals with armed or coming armed to this peaceful First Amendment assembly. We just want to be very careful about that. And again, I cannot stress that enough. We're going to have a lot of people in our city, and we want people to be safe.
And then also, the emergency police reform bill from the summer is supposed to prohibit what types of munitions police can use. Was that any discussion with the council today? Can you tell us what will be used if violence does break out?
That depends on the situation, and no, that was not discussed with the council.
Okay, and then lastly, for businesses, Mayor Bowser, you talked about businesses protecting themselves with regard to masks and whatnot. At this point, though, are you advising any businesses to possibly close?
I am not. I am, especially for businesses who are in this the restricted traffic area, to be mindful of the parking and traffic restrictions in their business operations to best support their employees and their customers. Yes.
Hi, Amanda Gomez. I write for Washington City Paper. A question for the chief. So the last time, right, Trump supporters descended, they went to Black historic churches and burned Black Lives Matter signs. And so I wonder, can you provide an update on those incidents? I understand they were investigated as possible hate crimes.
Yes, we're still working on that very closely with the United States Attorney's Office. We have been in daily communication with them about the progress on that investigation.
Didn't a Proud Boy admit to burning a flag? I wonder, I believe he lives out of state though. It was like a warrant.
Whatever group, at the end of the day, we are focused with the U.S. Attorney's Office on ensuring that someone is held accountable for that.
Okay. One quick question for the mayor. I wanted to follow up on a question that Mark had asked about schools. Can you just further tease out, because my understanding, just speaking with teachers, is, or even you've said it, that a problem of reopening schools was, not having teachers, not enough staff coming to support the classrooms and such. And I wonder, can you further tease out, why not wait to reopen schools if there's a chance that vaccinating teachers can give them more confidence returning to schools? Can you just tease that out for me?
Sure. Children can't wait, Amanda. Children can't wait. They have lost so much. And you have already heard Dr. Nesbitt and for many months describe the protocols that we have put in place at our schools to ensure that our schools are safe. And that is how we will proceed for the remainder of the school year. It has never been a contention, even of the Washington Teachers Union, that schools shouldn't open until a vaccine was 100% implemented. That has never been their contention. And I think you also know that we have an agreement with the Washington Teachers Union now. Actually, maybe that came after the last time we met. So we have an agreement with the Washington Teachers Union. Is back on November the 9th, 100% of our elementary schools were prepared with social distancing, I don't even know, all of our protocols, including signage, desk, computers, as well as the HVAC system upgrades have been complete at all of those schools. And I think by February the 1st, we will have all of our high schools complete with those HVAC upgrades as well. We also implemented a system of testing, which we think is working well, where we will circulate throughout the city so that all of the school children can get tested over the course of, I think, 10 days to 2 weeks. We have also mailed to each of our workers, and we will continue to mail to them an at-home testing kit where they can take a test, send it by mail, and get the results. So we have a very robust safety protocol system in place from our schools. I dare say it's the best that I've heard of. And more than that, we have been implementing care classrooms since the beginning of November. And with each week, we have more and more parents choosing care. And we have more feedback from our principals and parent communities about individual and sometimes individualized programs that will work for their school communities, kids, parents, and our workforce. So that's where we are. We're very proud of the work that we have done. We're also proud to have our teachers early in the prioritization for the vaccine. And so all of those things working together will have our kids back in school. Yes.
I saw your letter from, I guess, December 31st, where you're requesting National Guard assistance. Can you tell us a little bit more about that? I understand they're going to be unarmed, and what are they exactly
Well,
going to
they're always they're supposed to be unarmed. I've never requested armed guard in my time as mayor. But we think it's helpful to have our DC guardsmen who are our guard, that I have requested from the Secretary of the Army to assist MPD with traffic management. You notice all of those restricted areas generally require somebody to manage, and that's how our DC National Guard can be helpful.
Okay, and that I guess frees up more officers to?
It absolutely frees up more officers.
Do you know how many guard there will be?
I think we're going to be around 100.
Oh.
Yes, okay. These are really the last questions.
And Mark Seagraves, NBC Washington. Chief, another somewhat off-topic question, but I'm wondering, given what we've seen with Speaker Pelosi and Leader McConnell's homes in their home jurisdictions being vandalized, if you've taken any added precautions here in D.C. where these same legislators might own property, might own homes here, as far as providing security for their homes here.
Thank you, Mark, for the question. We do not really provide details about the specifics of security operations for our dignitaries in our city, but we are aware of what has transpired in their home states, and we're working very closely with U.S. Capitol Police on the intelligence that we have.
Thank you.
All right. Thank you, everybody.